Allergies. So this, you don't have allergies, do you? My favorite is activated quercetin. I think that this works the best for burning eyes, hives, itchy skin. Quercetin is great. It helps bring up your vitamin C and is very tolerated. You can use very large doses of quercetin without having a problem, most people. D-Hist is a name brand that we have in the office, and it's very safe. People can take 1 to 5 at a time, and it's supposed to help. The D is for decongestant, Hist is for histamine, and it either works for you or it does not. Yes?
The D-Hist, what I discovered about it was that when you're in acute, you really have to bump up the number of pills that you take, because if you go with the maintenance dose, it doesn't work at all.
Very true. You almost need 5 to 10 sometimes, depending on how congested you are. Yeah. Santa Ana sniffles, kick-ass allergy. Both of those are some of my favorites, because when you've got allergies and you're congested, you're going to use something a lot. If you use a NyQuil at night and then a NyQuil in the morning, it lasts all day because there's a lot of gunk in there to make it last. So with natural supplements, you've constantly got a faucet flowing, so you do need to repeat your dosing. However, Santa Ana sniffles is specifically designed for us Californians because we get those beautiful Santa Ana winds in the fall time. And kick-ass allergy is specific for Californians too, because of our grasses, our eucalyptus, and our red oaks, and all these things that tend to bother many people. And these are the tinctures where you do 6 pumps up to 12, depending on what you need. They have horseradish in them, which is really what clears things up. So sometimes people will need to put them in water so that it's easier to get down. But the nice thing is you can use as much or as little as you need to. You use a lot of it in the beginning, get the symptoms under control, and then back off of the amount that you're using. Very herby, just be prepared. Mold in the environment. So if you've got mold in the environment and you're having a lot of allergies because of that, or you're having allergies that are hard to treat, consider there may be a mold somewhere, and actually taking clove oil and diffusing that in your house can help to get rid of some of the mold that's in there. Of course, remediation and using bleach in your bathroom is helpful, but the clove is a natural way to do it. You could even clean with hydrogen peroxide. And then, like if it's in your restroom, you can clean with hydrogen peroxide and then diffuse oil in there afterwards, some clove oil. Hives on the skin, lavender and or frankincense oil. Bug bites, lavender and frankincense oil. All works really good to decrease the swelling and decrease the itch and decrease the reaction that's happening. And then this is a different kind of allergy, but Hist-Dow by a company called Zymogen helps when you've had a food allergy and you've already ingested it and you're like, oh my gosh, I realized that that bread was not gluten-free. And then Hist-Dow helps to reduce that tummy reaction that people get and systemic reaction to that. Probably should have put more pictures in here. Oh.
I've been separated and tried one at a time for a couple of weeks. Is there any of those that you think would be more apt to be causing itchy skin?
Well, there's probably a personal sensitivity to something, and I would think the mushroom one would be more likely to cause that. But yeah, anytime you try something, try one thing at a time, give it 3 or 4 days. And then if you have a reaction, let the reaction subside before trying something else, because then you get stuck in this. And if it's something that's causing hives, sometimes we get stuck in this hive reaction that doesn't go away for months on end because it's just a spinning wheel. So always try one thing at a time. So for asthma and COPD, these are most of these are homeopathy actually. Apotus is straight for an anti-cough homeopathy, remediates the cough. It's very whiskey-like. This is our Picana line of German homeopathy. And it's 1/4 to 1 teaspoon every 1 to 2 to 4 hours as needed. Most patients actually just kind of sip it out of the bottle as they go along, because a sip tends to be about half of a teaspoon for most people. Apple palm is for respiratory infections. This one works more at getting the phlegm out, because that's what sticks around forever. You get a cold for 3 days and then you're coughing for 2 weeks. You're not sick for 2 weeks, it's the inflammation and the phlegm that's lingering. And bronchi-purtue is more of an asthma, more of a wispy kind of cough. It will help you get stuff out of the deep parts of the lungs. Whooping cough helps with that. Irritated lungs due to smoke and smog. So when you go to Bakersfield to visit your family on the weekend, come back and get some bronchi-purtue to help kick out all that smog. Deep lung actually is very interesting. It's a herb, and we've gotten people off of their asthma inhalers and off of their steroids with it. And with these herbs, you know, when you're sick, you use a lot, decrease over time, and it's anywhere from 6 to 12 pumps, and you can repeat that every 5 minutes. And this really reduces the spasm of the lungs, helps to open the lungs up so that people can start breathing again better. Has horseradish in it, so it can be a little bit of a kick, but I think the horseradish is the part that kicks out the phlegm and the inflammation that's lingering in these people. Serious cough is a herbal remedy, same thing, 6 pumps to 12 pumps, repeat. And this one is specifically for a cough. There are tons of different cough syrups that you can get. You can get elderberry. There's like a Bliss River elderberry from a lady who locally makes it and sells it at the farmers markets. Elderberry has a lot of vitamin C, can soothe the cough and kind of calm that down too. I don't know why I didn't put that up there. And I definitely think that paleo and anti-inflammatory diet is super important. For some folks, we really actually have to look at food sensitivities and look at their allergies, because sometimes they don't realize that the tree that they just planted in their front yard is causing the majority of their problems. Avoiding milk, like cow's milk, goat's milk, sheep's milk, can be very good at helping with asthma and COPD, because milk just causes a ton of inflammation. Depression, anxiety, and mood imbalance. This can kind of be all over the place. So definitely meditation, time for spirituality, and exercise, whatever you'll do, can be very beneficial for any of these issues. If you're anxious and you go for a walk, you can work some of that energy off. When you're depressed, even though it may pain you to get out and go for a little walk on the beach, you're releasing endorphins, which actually are the treatment for depression. And that can be very important at getting better. Somebody who's sitting in their living room all the time doesn't mean that they're depressed, but if they are depressed and sitting in their living room, it's very hard to get them out of that stupor without getting them moving and getting them out of that space. Counseling, cognitive behavioral therapy, brain mapping, and brain retraining, and I put ants up there because oftentimes most of these things are fed by our automatic negative thoughts. Got to stop those right away. Sometimes it's just how we're trained to think or how we've believed that we think and are, and seeing somebody who helps to remap the brain can really help get us out of these depressions, help get us out of anxiety, and help with mood imbalances. If a dog attacks you and you're afraid of every single dog for the rest of your life, you can actually get brain retraining and make it so that every time you hear a dog bark, you're not having a panic attack, that you can see a dog walking across the street without having a major meltdown. These things really work. Just got to find the right person to deliver the service to you. Foods that cause inflammation and food allergies definitely cause depression and definitely can cause anxiety. Just because you have depression and anxiety doesn't mean you have a food allergy or a food intolerance. But when you find that your stuff is hard to treat and you've hit every single issue, including the hidden issue under the rug that you forgot about 20 years, when it's hard to treat, that's when you go look at the food and say, okay, I always have coconut milk in my coffee. Could that be making me anxious? If you've got a food sensitivity to coconut milk, that very well might be causing a chemical imbalance in the brain, and you may be having some depression or anxiety from that. Especially gluten. Gluten can really be a doozy here. Okay, so this I did put a picture, wow. So this is just to show with depression, you've got serotonin here, norepinephrine, and dopamine, all of your neurotransmitters. When they're all in balance, you've got good mood and good cognition. When you get too much norepinephrine from stress, you become very energetic, you're very alert, you're hypervigilant. Too much serotonin, memory gets shot, you can become obsessive, you get obsessive compulsive features. So there's all these different things of balancing. Depression isn't like, oh, I'm sad, so I'm depressed. No, it's actually your body's ability or lack of ability to make neurotransmitters. The ability to make neurotransmitters is depressed, held down, and so it's called depression. I also showed this picture because I wanted to just kind of say that you can, dopamine deficit, you get a slow reaction time, no energy. A serotonin deficit, you get OCD-like symptoms, obsessive thoughts, compulsive behavior. And so you don't want to necessarily just treat with one type of dopamine or one serotonin. Oftentimes we have to approach it bimodally, so a couple different ways. This is a picture to show that from one end of a nerve to the beginning of another nerve, you have these things kicking out, neurotransmitters. You have these receptors accepting neurotransmitters, and then you have these little holes reabsorbing neurotransmitters, sometimes even before they're able to be used. Drugs, different drugs, work on each of these spots individually. Some of them work on a couple of spots. There is nothing in natural medicine that does that. So oftentimes when patients are stuck with depression or anxiety, we have to put them on a couple of different things to address how the nerves communicate. And it can be a little bit challenging and fun. I think it's fun. Patients probably don't think it's very fun. SAMe helps you with making all neurotransmitters. So if you're a dopamine deficient, it'll help you make dopamine. If you're serotonin deficient, it'll help you make serotonin. There are some people, though, that have too much toxins in their skin and in their system, in their cells, and when they start SAMe, it actually makes things worse. That doesn't mean that SAMe is necessarily bad for them. It's usually a sign you need to go to the doctor and figure out how to get toxin out and get inflammation down. 5-HTP is a precursor to serotonin specifically. So depression can be helped with that if we're having a lot of OCD and like obsessive hand washing and starting to notice like, oh gosh, I'm always worried about locking the door. 5-HTP is one of our go-tos there. You can use one. Some people use it twice a day. The dosing can be very liberal, but we don't want to end up doing too much because if you start getting overexcited and even more depressed or more anxious, then we've gone too far with it. And so backing off of that is important. Being able to have somebody that you can talk to, whether it's a friend or a family, and going, okay, have you noticed that I feel that I'm acting less depressed? Have you noticed that I'm not running to the bathroom every 5 minutes, or whatever the case may be? Sometimes when we're not feeling good at 100%, sometimes we need to incorporate our friends and family to say, yeah, that is getting better, or no, maybe it's not. CeraVu is a sublingual, and it comes from amino acids. Amino acids are very important at regulating mood. The good thing about the CeraVu is it actually works similarly to an antidepressant in that it keeps neurotransmitters available in the middle of the nerves so that the nerves communicate quickly. One of the problems with depression and pain and anxiety is that the neurotransmitters get reabsorbed by the nerve too quickly. And CeraVu keeps these things available so the messages go through correctly. I kind of split these up because Lavella and theanine serine are anti-anxiety specifically. Theanine serine can help with sleep. It's a great remedy for, okay, tomorrow I've got to talk and I'm already anxious before I'm going to bed the night before, or oh, I got to be around family and what am I going to do? I don't want to be, too anxious. You can take it the night before, helps with sleep. and you're less anxious the next day. So it's a very good, well-rounded anti-anxiety medication. Lavella is a lavender pill. This is a cute little gel cap. Tastes like lavender. Well, you don't really taste it, but you get lavender burps, and it helps you sleep very tranquilly. The worst thing about it is lavender burps. Cystabil. So this is my homeopathy for the brain. I love Cystabil. It is my liquid Xanax, and you can use as little or as much as you need. If you use a lot, then you will get tired, but usual dosing is anywhere from 10 to 20 drops, sometimes up to 30. You can put it in hot water. What I usually recommend is people to get a cup of hot water, put your drops in there and sip on it until you're no longer anxious. And as soon as you're done being anxious, put it down. If there's something else that has happened and you're starting to have a full-on panic attack with the whole dread and gloom going on, you can take that whole little cup of tea, you can drink the Cystabil straight, and it will get you out of a panic attack. And it's safe enough to repeat. There's not enough alcohol in it to cause a head change. But if you have to take this like at 30 drops 3 times a day, you might be on the tired side. So it is something that you want to try before you drive. Make sure that, if you have to be driving, that it's not going to make you too groggy. But if you're having a panic attack, you shouldn't be driving anyways, right? Liquid Bliss and Emotional Ally are 2 augmenters of neurotransmitters, specifically serotonin and dopamine. I like the Liquid Bliss because it really lifts the mood. It's great for grieving people. It's great for when you have a lot of pain. It's great for anxiety. It's great for when you're overwhelmed. And you can do the dosing as little and as high as you want. And it's like the other tinctures that are in a pump. You use a lot at the beginning and back off as you start to feel better. One of the first things I hear people say randomly is, I was driving down the road and I'm singing in the car and I never sing. And that's usually a sign that somebody's mood and spirit are lifted up. You can use 6 to 12 pumps. You find your dose. Mine is 12. I start with 12 right away. I don't mess around with 6 anymore. And it's safe to use, so hit it heavy. And if you find a maintenance dose of 6 in the morning, 6 at night on most days, and that keeps you even keel, safe enough to do that. Emotional Ally is for anxiety, comfort, and emotional support. So somebody's screaming and yelling at you and you've got an anxious tummy over it, Emotional Ally is where you want to go. Or Cystabil if you're having a panic attack from that. Liquid Bliss and Emotional Ally can be really good, especially during heartbreak and grief, because some of us actually have physical symptoms during those stressful times, and the 2 together can get rid of the mood imbalance, make you feel more energetic mood-wise, as well as getting rid of the tummy aches and the nervous stomach, the cramping and whatever else kind of butterflies in the stomach that happen during those times. All right, so back to that picture. Any questions about those?
Can you take something like that, the last 2 you were talking about, can you take something like that if you're taking a prescription?
Yes, and that is what is, so yes, you can take Liquid Bliss or Emotional Ally even if you're on a prescription. Whether the prescription is for chronic pain or for anxiety or depression. It helps you make a little bit of extra dopamine and serotonin, which is good because a lot of antidepressant type medications, the body gets used to them and so they don't work as well. But when you add things like a Liquid Bliss, actually ever so often, it actually kind of resets those medications so that the brain can start working with them a little bit better. So it improves their use actually. And as we all know somebody who's on an antidepressant at some point. If you come across something sad, the antidepressant just doesn't, it's not going to get rid of that sadness. It just makes it so you don't succumb to it. So Liquid Bliss and the Emotional Ally can kind of help uproot you out of that event.
Are they addictive?
No, there is a little bit of alcohol in it, but if you put it in water, it flashes off the alcohol, but there's nothing addictive in it and there's not enough alcohol in it to do anything and give you a jolly whatsoever. Sleeplessness to insomnia. I'm sure nobody has sleeplessness in here. There are multiple reasons for insomnia, and sometimes there's no reason. But if there's a reason, you must address it, because if you don't address that underlying issue, you're never going to get to sleep, no matter how much stuff you take. Sleepy Nights is a tincture, again, from that same line. And this, in my opinion, can help you fall asleep, but it's not long-lived. I like the Sleepy Nights for when you wake up and you're like, oh shoot, I had to go to the restroom and now I'm awake. Sleepy Nights helps bring you back to sleep without grogginess. Because it's short acting, even if you wake up every 2 hours because your prostate is going, you can take it every 2 hours to return to sleep, and you shouldn't be waking up groggy. If you wake up groggy, you have to take less. Melatonin is a great antioxidant, but it is also the hormone that your body makes when it's time to go to sleep. When we're really little, our body doesn't make a lot of it, and as we age, our body starts to make less of it. We use this in higher doses for cancer treatment. 2.5 to 10 milligrams is typical for an average human being. When you're younger, like less than menopause or andropause, you don't want to use melatonin every single night unless you have a reason, like you don't make melatonin or you have cancer, because you don't want your hormones to forget how to make it. You don't want your brain to forget how to make melatonin. But once you hit that andropause or that menopause, you're not making as much melatonin, and that becomes a more valuable resource for sleep. Cognimag is one of my favorite sleep remedies because it has magnesium in it, so it helps relax the muscles. The Cogni is to help you with cognition. The worst thing about sleep medicine is you take it, you sleep good, and then you're just not any good the next day because you're groggy and brain fog and the whole nine. Cognimag is the answer to that. It has a blend of B vitamins and a couple other things in it so when you wake up in the morning, you're ready to go. Your brain is ready to go. You're not cloudy, you're not foggy. So a very good remedy. Cognimag is great for people low with magnesium, so high blood pressure people on statin medications. It's excellent for my Lyme patients and my tick-borne infection patients because magnesium runs low in them all the time. And they always have brain fog, and nobody wants to wake up with brain fog. CBD with or without THC. And you have to be really careful with the THC component because it comes from the cannabis plant, but there's an indica and then there's a sativa. And different people have different responses to that, but typically the indicas put you to sleep. Too strong, you might wake up really groggy. The sativas can tend to make people anxious, and for some people it makes their brain too awake. This is not a good blend if you are trying to sleep. So this is one of those things where if you're using CBDs, you want to know where you're getting it from, have a good line of communication from the person who's providing it, whether it's a dispensary, a doctor's office, or whatever the case may be, so that you're able to zone in and use a product that's going to work with you. I like Insomnitol. We carry it in our office. I haven't seen it anywhere else except from Dr. Marquis's office. It is a chewable with a little pinch of melatonin. It's got inositol, which helps with blood sugar management. Sometimes people wake up late at night because their blood sugar goes too low or their blood sugar goes too high, and we're not all checking our blood sugars all night, so we may not know that that's going on. So this is a good remedy when nothing else is working and people are waking up and they're like, I don't know why I woke up, I don't have to go pee. Maybe a blood sugar issue. Insomnitol is great for that. An Epsom salt bath, just jumping into a nice Epsom salt bath before bed can really relax the muscles. That can be useful, especially on a stressful day. And then we have, again, the cognitive behavioral therapy and feedback. So especially for people where something happened to them in their sleep, those things work really good because your brain is thinking, oh, this is going to happen when I go to sleep. You can retrain your brain so that it's not having that fear or that thing going on. I have had patients who all of a sudden, 15 years after they hit menopause, they're anxious at night, they're waking up, they're afraid of everything. They've never had that problem with fear. They've never been afraid of anything in their life. And why at 65, 70 are they having fear? And it ended up being a hormone issue. So giving her a little bit of progesterone was very beneficial. And in her case was very safe. So there's always, that underlying issue, And sometimes there is not an underlying issue. All right, ailments to see a doctor about. So as a healthcare provider, I always have to put these disclaimers in here. No supplement, homeopathy will work perfectly. They will be less effective if your health condition is moderate to severe. None of our natural approaches will work without the holistic lifestyle. So the person who's eating McDonald's 3 times a day, if he tries to use some homeopathy to help with his cold, it's not gonna work. As much as we may pray and hope, not gonna work. So here we go, dizziness. Find out the cause of your dizziness because the cause is gonna lead to treatment. So if you're dizzy because you have allergies, we gotta treat the allergies because you can't treat the dizziness symptom without treating the allergies. We have something called vertigo oil in the office, and I think that doTERRA might have this too. And it's just an oil that you can diffuse in the house. Some people will put it behind their ears, on their wrists, and that can help with the sensation of vertigo, which is you spinning around. Antihistamines can help if you've got allergies. This Dix-Hallpike maneuver is sometimes when we have allergies, there's these tubes in your ear that have these cute little stones in them. And when you have allergies, the tubes swell and the stones get stuck. And these stones are supposed to move around. That's how we keep our balance. They move around in these little circles. And the Dix-Hallpike maneuver is actually a way to turn somebody's head and get those stones unstuck. BPV is benign positional vertigo. This is the most common reason people have vertigo. Not necessarily in old people, not necessarily in young people, but it's where you're sitting and you stand up and you're dizzy. You lay down, you jump up to run to the bathroom and you're dizzy and you fall. So all that is gravity. All of the blood is in the body because you've been laying flat or sitting down. You stand up real quick, well, the blood's still down here. You gotta give it a second to get into your brain before you start running. This was a problem for me when I had my kid because she'd start crying and I'd jump out of the bed, and by the time I got halfway through the floor to go to her room, I'd be on the floor and my husband would be waking up going, what just happened? And I wasn't doing the right thing. So if you have this, you are to get up slow every time. It's a lifestyle change. Before you get up, bend your head down, chin to your chest, stand up, and then slowly bring your head up. That actually moving your head to your chin to your chest keeps all the blood in your head so you don't lose it when you stand. So if you're going from here to here, the gravity kept my blood here. But if I bend my head down, I've locked all my blood in my brain, slowly get up, slowly lift my head up, my body's been able to acclimate, and then I can get running. So it's a lifestyle change, because if you wake up in the middle of the night, you're like, oh shoot, I gotta go potty. You gotta think about getting out of the bed carefully, putting your chin to your chest, and moving that up slowly while you're trying to not pee your pants. You can do it. It's a lifestyle change, but you could do it. If you're dizzy due to an arrhythmia, then you need to probably go to the doctor. Oftentimes, if you're dizzy because your breathing is affected, then you may need to go to the doctor. It usually means that something else is going on. If you have an arrhythmia and you're on medication and you have this, any of these are fine to try because your arrhythmia is being treated. High blood pressure can cause dizziness if blood pressure is too high and has huge spikes. Any suggestion below is not going to work. So if your blood pressure is running 200 over 100, as much as I want this to work for you, it may not. A multivitamin to balance out all your minerals and nutrients. If the body is missing some minerals and nutrients, you may have high blood pressure. Hawthorn is a great way to reduce blood pressure. It actually reduces both systolic and diastolic at least 10 points. Almost any medication I'll prescribe you will reduce your blood pressure 10 points. So here's a natural way to do it. Most patients take Hawthorn 1 pill twice a day. We have Ultramag up here, and this has got 5 different kinds of magnesium. This can cause a little bit of loose bowel movements, but in most patients with high blood pressure, the magnesium gets into the blood vessels before it ever gets to the digestive system to cause that. However, if people notice loose bowel movements with us, they can switch to magnesium glycinate because it will relax the muscle in the blood vessel. And your Ultramag is twice a day because you don't just have high blood pressure during the day, it might be high at night. There may be a spike at night. Most likely not, but we want things to be balanced. With blood pressure, consistency is key because your heart and your lungs and your kidneys always have a rebound. So if you take a blood pressure medicine for 5 days and then you stop taking it, your body has a rebound effect from that because that medication isn't suppressing the pressure anymore. And that causes more variation in blood pressure, more likely to have a spike, more likely to have a stroke or an event from that. So consistency is keying when it comes to blood pressure. Our methyl CPG and fish oil and CoQ10, that's our standard 3 for high blood pressure. They all work well together for cardiovascular. Vasotensin is a prescription supplement that lowers blood pressure and the tension, especially the systolic tension and the blood pressure. And Perfusia has arginine in it, which helps to open and relax blood vessels. Arginine helps make nitric oxide, so this helps also with erectile dysfunction. That's a side effect. This is a side effect of a good blood pressure medicine too. High blood pressure, lifestyle. There are people who have high blood pressure because they're genes, but it's very much lifestyle driven. So paleo to primal-like diet, lots of vegetables, a diet rich in plant fiber. Fiber moves bad things out. Little to no sugar, always avoid the triad, fat, sugar, and salt. Oh, ice cream, bad news, but tastes so good. Often a low salt diet can be very helpful for people with high blood pressure. Oftentimes salt just makes your blood vessels hard. And if they're hard, they're losing their elasticity, they're not gonna respond well. So they stay tight, high blood pressure. Treat thyroid issues. Too hyperthyroid and hypothyroid can cause high blood pressure. Exercise, stretching, resistance, whatever exercise you will do, and consistently doing it will help with blood pressure. If you're somebody who only exercises twice a month, that exercise twice a month actually raises your blood pressure because you're putting more stress on your body. So it goes back to consistency so that your body doesn't need to compensate for it, sees it as something that's helping it to maintain. And get the toxins out of your life. So whether it's stress toxin relationships, if you're drinking the Monsanto glyphosate, stop doing that. Positive self-talk and positive mindset are super important in this. Sometimes just having a positive affirmation and seeing that, having somebody who tells you a positive affirmation can bring that blood pressure down, and seeing that and hearing that often. Even if you're putting it on a recorder and playing it before you go to bed at night, so you're hearing that positive feedback even before you go to sleep.